A very good morning to all the doctors and everybody who have joined the webinar today. It's a pleasure for us to have you all here. This is Dr. Shivangi Singh and I feel very fortunate that I've gotten this opportunity to present the topic Homeopathic treatment for melasma with Radaropus. And I'm very thankful to the BJNRX and BJN publication for giving me this opportunity to represent this topic in front of you all. So let's begin with the introduction part. So, introduction. Melasma is a skin condition that is associated with female hormones and overexposure to sun rays. It is also known as colasma or the mask of pregnancy. Areas such as forehead, cheekbones, and the upper lip are prone to developing melasma. However, it can also affect the chin, nose, sides of the back, lower cheeks. It is an acquired condition characterized by development of brown patches on the skin of the face and the neck. This condition is more common in women than men. It generally occurs during the second or third trimester of pregnancy. This is very important. Young women with brownish skin tone are more susceptible to this disorder. Although it is not a hazardous disease, it affects the appearance of a person, particularly making women overtly self-conscious. So this was all about introduction. Now moving on next slide, that is definition part. Melasma is a skin condition characterized by brown or black gray patches or freckle-like spots. It often called the mask of pregnancy. Melasma happens because of overproduction of the cells that makes the color of your skin. It is common, harmless, and some treatments may help. Melasma usually fades after a few months. Melasma is a focal hyperpigmentation result from neoplastic process, usually due to sun exposure. So, as we discussed in the slide, melasma is a common acquired pigmentary disorder presenting as irregular lights to dark brown macules on the face, mainly the cheeks, forehead, and nose. The term melasma is derived from Greek word melas, meaning black, pointing to the color of clinical lesions. The actual prevalence of melasma is unknown, reportedly ranging from approximately 1 to 33% depending on the location of the population. So, melasma is a multifactorial disorder with a variable interplay between genetic, hormonal, and environmental factors. Like sun exposure, family history, and pregnancy are the most commonly observed factors associated with melasma development. Now, moving on next slide, that is etiology. Etiologic factors include genetic influences, ultraviolet radiation, pregnancy, hormonal therapies, cosmetic, phototoxic drugs, and anti-seizure medications. Melasma stimulates melanocytes by the female sex hormone estrogen and progesterone, producing more melanin pigment when the skin is exposed to the sun. So, as we discussed in the previous slide, its multifactorial cause unknown idiopathic form due to external cause such as long continued friction or pressure, excoriation, unusually repeated or prolonged, heat or cold. Now moving on next slide after etiology, I'm going to discuss about the epidemiology part. The persons of any race can be affected. Melasma is more common in darker skin types rather than in lighter skin types. And it is particularly more common in light brown skin type. Women are affected 9 times more than men. Melasma is rare before puberty and more common in reproductive years. Melasma is present in 15 to 50% of pregnant patients. The prevalence varies between 1.5% and 33% depending on the population. So, melasma has been observed to be one of the commonest dermatoses across all world countries. It is the most common pigmentary disorder and fourth among dermatoses in 546 dermatological patients in Nepal. So this was all about the Nepal part. Now similarly, melanodermatosis, including melasma, was the third most frequent cause of skin related consultations among 57,000 patients in a Brazilian study. In a study conducted in Saudi Arabia, pigmentary dermatosis represented the fourth largest dermatosis group. So pigmentary disorder were also the third most frequently observed disease among 2,000 dermatological patients in Washington. So this was all about the epidemiology part. Now moving on the pathophysiology. In pathophysiology, melasma risk increases with increasing sun exposure. The mechanism probably involve overproduction of melanin by hyperfunctional melanocytes. Other than sun exposure, aggravating factors include autoimmune thyroid disorders, photosensitizing drugs. The next one is sun exposure. So ultraviolet rays from the sun stimulate the melanocyte. In fact, just a small amount of sun exposure can make melasma return after fading. Sun exposure is why melasma often is worse in summer. It also is the main reason why many people with melasma get it again and again. A change in hormones. Pregnant women often get melasma. When melasma appear in pregnant women, it is called colasma also, or the mask of pregnancy. Birth control pills and hormone replacement medicine also can trigger melasma. Cosmetic, skincare product that irritate the skin may worsen melasma. So this was all about the pathophysiology part. Now I'm going to discuss more about it. Like in pathophysiology, the most important factor is exposure to sunlight, which induces the production of alpha melanocyte stimulating hormone and corticotropin as well as, which contributes to increased melanin production by intraepidermal melanocytes. Prolonged UV exposure induced dermal inflammation and fibroblast activation, upregulate stem cells factors in the melasma dermis, result in increased melanogenesis. Now the next slide is about the types of melasma. So there are three types of melasma and they have to do with the depth of the pigment. First one is epidermal. Epidermal melasma has a dark brown color, a well-defined border, appear obvious under black light, and sometimes responds well to treatment. So in epidermal melasma, the dermoscopy said the scattered island of brown reticular network with dark fine granules, and the treatment is usually has a good response. In the second one is dermal. Dermal melasma has a light brown, a bluish color, a blurry border, appear no differently under black light, and does not respond well to treatment. Mixed melasma, last one, the third one is mixed melasma. Mixed melasma, which is the most common of the three, has both bluish or brown patches, shows a mixed pattern under black light and show some response to treatment. So this was all about the types of melasma. Now moving on next slide, that is symptoms. Now the symptoms include melasma causes irregular brown or grayish brown patches on the skin of the face and the neck. The brown colored patches are seen on the forehead, nose, cheeks and the upper lip. They result from the increased amount of skin pigment called melanin. In some rare cases, there may be skin discoloration on both arms. There may be epidermal melasma or dermal melasma, or a combination of both. Melasma does not cause any symptom that many people dislike the way melasma makes their skin look. So melasma causes patches of discoloration. The patches are darker than the usual skin color. It is typically occur on the face and is symmetrical with matching marks on both sides of the face. The other areas of your body that are often exposed to sun can also develop melasma. So brownish colored patches usually appear on the cheeks, forehead, bridge of the nose and chin. It can also occur on the neck and forearms. The skin discoloration does not do any physical harm but may feel self-conscious about the way it looks. Now the next slide is about risk factors. It occurs primarily in pregnant women, women taking oral contraceptives, dark skinned men. So melasma appear on women's skins much more often than men's skin. Just 10% of people who get melasma are men. People who have blood relative who had melasma also are much more likely to get melasma. In women, melasma fades slowly and completely after childbirth or cessation of hormone use. In men, melasma rarely fades. So the skin color, as we discussed in the slide, melasma occur most commonly in people with light brown skin tone, particularly they live in areas with high level of sun exposure. Pregnancy, because melasma is more common during pregnancy, affecting 15 to 50% of pregnant people. This may be due to pregnancy hormone. The potential triggers for melasma can include changes in hormones during pregnancy that we also call cholasma, hormone treatment or taking birth control pill, certain skin products if they irritate a person's skin. Some medication include anti-seizure medication and those that makes the skin more sensitive to sun exposure, such as include retinoids, some blood pressure medication, and certain antibiotics. So this was all about the risk factors of melasma. Now moving on next slide, that is the management part. Sun protection. Use broad spectrum sunscreen every day and reapply it every 2 hours. Whenever possible, seek shade and wear protective clothing. Avoid waxing. Waxing can worsen melasma. Wear a wide brimmed hat outside whenever you go outside. Choose gentle skincare product. Avoid scented cosmetic products that irritate your skin. Soap. Some scented soaps are thought to cause or worse melasma. If oral contraceptive birth control pills are the reason, then stop them. So if you have melasma, be sure to avoid. There are some triggers also, like there are some management part like hormones treatment, especially ones that involve estrogen, birth control, especially oral contraceptive pills that contain estrogen and progesterone, LED light from your television, laptop, cell phone, and tablets, medication that may cause or worse melasma, skincare product that irritate your skin, and the tanning beds. These are the things you should avoid if you have melasma. Now I'm going to discuss a case. This was all about the melasma. So a female patient of age 29 years reported at my clinic with the chief complaints of black discoloration of face, with pigmented macules, especially on forehead and both cheeks, for 2 years, with itching, down dark brown colored, irregularly shaped macules and patches with ill-defined margins. The eruption had worsened with sun exposure. At this time, she felt itching and stinging as well as the hypersensitivity to touch. Along with this, she had white discharge from vagina over 2 to 3 years, which is thin, white, and copyish. Now, moving on next slide, that is history of present complaint. Patient was apparently well 2 years back. Patient presented with a 2 year history of facial eruption on forehead and both cheeks. This skin disease is similar to pigmentation. There there are black patches on face with itching over the affected area, and the eruption had worsened with the skin exposure. Eruptions are very sensitive to touch. Along with this, she had white discharge from vagina for 2 to 3 years, which is thin, white, and copyish. The next slide is past history. Patient at the age of 17 years had intermittent asthma attacks, which was cured after taking homeopathic treatment. Family history: mother has hypertensive and father was diabetic. She has two younger siblings who are healthy and alive. Now, the mentor journals: she was averse to solitude. She wants company. That means she was intolerant of contradiction. She don't want any opposition. She is averse to consolation as she considering it irritating. The patient had fear of unknown situation. She think no one in the family understand her. So these are the mental journals of my patient. Now moving on next slide, that is the physical journals. Now, thermal reaction: patient is chilly, craves for hot drinks, prefers summer, cannot tolerate cold, want extra covering. Appetite: her appetite is good, having 3 meals per day. Taste: desire for spices, food, and aversion to fruits. Thirst: normal thirst for 3 to 4 liter of water per day. Urine: normal micturition. Stool: normal, unsatisfactory once in a day. Sleep disturbed due to itching on the face, and dreams are like not specific. Now, the gynecological history: menarche at the age of 15 years, the cycle and duration 5 days flow, and the flow was normal. Now I'm going to the licoria part. Since 2 to 3 years with creamy white copyish and thin moderate discharge, having offensive smell with generalized weakness. So thank you so much for staying with us. We will starting the presentation and training. How can we reporterize this case with the help of Radaropus? So I will be sharing my screen to all of you. So this is Dr. Shivangi, and I will be demonstrating you all about how you can get started with Radaropus and how can we reporterize the case. So before I start, let me explain to our viewers how this interface works. On the right hand side panel of your screen, you have a short chat box. You may type your question or whatever message you have. Right there, a press button next to it to send it to us. Now I'm going to start my presentation. So whenever you open your Radaropus software, it would open exactly like this on your main document screen. Synthesis Adonis repository is open by default. Synthesis repository is exclusively available in only Radaropus software. Above icons are known as icon bar or toolbar. These are all the icons, and these 5 icons which are present on the left hand side of your screen are known as primary icons. Consist of repositories, references, patient management, remedies, and families. Now I'm going to start my reporterization. First of all, I'm going to this repositories icon. If you click on this repositories icon, you will get all the list of repositories. Radar comes with multiple repositories. So whatever repository you want to open, you can scroll with the help of your scroll bar and search. Else you can search with the help of this search bar. Search for a repository. Write down the name of the repository that you want to search in the search bar and you'll get your result. I'm going to search my synthesis. Okay, now my synthesis is here. Today I'm going to do my repertorization from Synthesis Adonis repository. This repository is a successor version of Synthesis Treasure Edition. The number of rubrics and remedies have been increased in this repository. So as soon as I clicked on this Adonis repository, my repository would open on my main display screen. So for doing the reporterization from this repository, I will be needing few icons. The first one is this binocular, find rubric. If you click on this binocular, you will get this navigation window. In this navigation window, we have all the chapters that comes under this particular repository. So I'm going to take my first symptom. The patient is intolerant of contradiction. She don't want to be contradict. So contradiction is a mental symptom. I'm going to the mind chapter. If you click on this mind chapter, you will get all the rubrics. They're arranged alphabetically. You can search your rubric by scrolling. Else you can search with the help of the search bar. Start typing the first letter of the rubric you wish to see. Write down your symptom in front of this search bar. The patient is intolerant of contradiction. So write down here contradiction. Just write down the initial. You will get your rubric below. Contradiction. Intolerant of contradiction. Click on this. Now press enter button. Now my rubric have opened on my main display screen from mind chapter. Contradiction is my rubric. Intolerant of contradiction is my sub rubric. So we have multiple clipboards here. They are just like our repertorial sheet. So for doing the repertorization, we have to add this rubric into the clipboard and it will automatically get repertorized. So for taking any rubric into the clipboard, we have three methods. The first method I'm going to tell you is dragging and dropping. With the help of your cursor, you can drag it and drop it like this. Next two method I'm going to tell you with my subsequent rubrics. The next symptom is patient is having desire for company. Patient is having desire, company desire. So I'm going to the mind chapter for this rubric. Now I'm going to type here company, just initial, desire for. Now press enter button. Now my rubric have opened on my main display screen from mind chapter. Company is my rubric, desire for is my sub rubric. Now I'm going to add this second rubric into the clipboard with the help of second method. And my second method is plus button. Plus button on your keyboard. The button next to the backspace, that plus button, press that plus button and rubric is added to the clipboard. The next symptom I'm going to take, the patient is having consolation aggravation. So I'm going to the mind chapter. I'm typing here consolation aggravation. She don't want to be consoled, so patient is having consolation aggravation. So from mind chapter consolation aggravation, my rubric have open here. Now I'm going to add this rubric into the clipboard with the help of my third method, and my third method is this icon. Take the current rubric icon next to this binocular. As soon as I clicked on this icon, my rubric is added to the clipboard. Now the next symptom I'm going to take, the patient is having discoloration on skin that we call melasma. So I'm going to the skin chapter, skin, write down here discoloration, melasma. Now my rubric have opened on my main display screen from skin chapter discoloration melasma. Now I'm going to add this rubric into the clipboard with the help of my first method, that is dragging and dropping method. With the help of my cursor, I'm going to drag it and drop it. The next symptom I'm going to take, patient is having itching from sun exposure. So I'm going to the skin chapter again, skin, itching, sun exposure from. Now press enter button. Now my rubric have opened on my main display screen from skin chapter, itching, sun exposure from. Now I'm going to add this rubric into the clipboard with the help of second method, and my second method is plus button. Plus button on your keyboard is the second method. As soon as you pressed your plus button, your rubric is added to the clipboard. The next symptom I'm going to take, patient is having black discoloration of face. So I'm going to the face chapter. Write down here discoloration black. Patient is having black discoloration. So write down here black. Press enter button. Now my rubric have opened on my main display screen from face chapter discoloration black. I'm going to add this rubric into the clipboard with the help of third method. And my third method is this icon. Take the current rubric icon next to this binocular. So as I told you, as soon as you pressed your this icon, your rubric is going to be add this to this clipboard. I'm going back to my navigation window. The next symptom I'm going to take, the patient is having itching on eruptions. Patient is having extreme itching. So again, I'm going to the face chapter, face, write down here eruptions, only initials. You'll get your rubric below, eruptions, itching. Now press enter button. Now my rubric have open on my main display screen. From face chapter, eruptions, itching, I'm going to add this rubric into the clipboard with the help of my first method. And my first method is dragging and dropping. With the help of your cursor, you can drag it and drop it like this. Now I'm going back. The next symptom I'm going to take, the patient is having the problem of copious licoria. So I'm going to the female genitalia 6th chapter. You'll get all the rubrics that comes under to this particular chapter, and you just search your rubric by scrolling, else with the help of this search bar, start typing the first letter of the rubric you wish to see. The next symptom is patient is having copious licoria. Write down here licoria, only initials. Copious. CO, only initial. Now my rubric have open on my main display screen from female genitalia sex chapter, licoria copious. Now I'm going to add this particular rubric into the clipboard with the help of second method, and my second method is plus button on my keyboard is the second method. So as soon as I press my plus button, my rubric is added to the clipboard. The next symptom I'm going to take, patient is having the problem of white licoria. So I'm going to the female genitalia sex chapter again. I'm going to type here in front of this search bar, start typing the first letter of the rubric you wish to see. Licoria white. Wait a moment. Licoria white. Now press enter button. Now my rubric have open on my main display screen from female genitalia sex chapter, licoria white. Now I'm going to add this rubric into the clipboard with the help of third method, and my third method is this icon. Take the current rubric icon next to this binocular. Now click on this. Now my rubric is added to the clipboard as soon as I click on this. The next symptom of my patient, I'm going back to my this navigation window. The next symptom is patient is having desire for spices. So for desire and aversion, I'm going to the genetics chapter. In this chapter, you'll get all the desire, aversion in food and drinks rubric. And I'm going to this food and drinks. Write down here spices, desire. Now press enter button. Now my rubric have open on my main display screen from genetics chapter, food and drinks, spices, desire. And I'm going to add this rubric into the clipboard with the help of my first method. And my first method is dragging and dropping. With the help of your cursor, you can drag it and drop it. The next symptom I'm going to take, patient is having aversion for food fruits. So I'm going to the genetics chapter again. The next symptom I'm going to take, patient is having aversion from fruit. So again, I'm going to this navigation window. If you click on this navigation window, you'll get this genetics chapter. Write down here food and drinks, fruits, aversion. Click on this, press enter button. Now my rubric have open on my main display screen. From genetics chapter, food and drink, fruit desire, fruit aversion basically. So I'm going to add this rubric into the clipboard with the help of second method, and my second method is plus button. Plus button on your keyboard, as I told you, is the second method. As soon as you press your plus button, your rubric is added to the clipboard. Now, the last symptom of my patient is the last symptom I'm going to take. The patient is having the patient is chilly patient. So patient is having a desire for warm things. So again, I'm going to the genetics chapter. Write down here heat, lack of vital heat. Now press enter button. Now my rubric have opened on my main display screen from genetics chapter. Genetics chapter heat, lack of vital heat. Now I'm going to add this rubric into the clipboard with the help of third method. And my third method is this icon. Take the current rubric icon next to this binocular. As soon as you press this icon, your rubric is added to the clipboard. So I have taken all the rubrics into the clipboard. Suppose you want to go to your analysis or repertorization. So click on this clipboard and you'll get your repertorization, your analyzing sheet. You'll get your chapters as well as the rubrics, sub rubrics. You'll get your remedies along with the grading. So we have taken total 12 rubrics here. Phosphorus cover all the 12 rubrics and the total is 24. If you add these number like 1 plus 4 plus 2, 1, 1, the total will be 24. Sepia cover 9 rubrics out of 12 and the total is 25. So in the same manner, you'll get your grading. Now suppose you want to read any remedy from your probable remedy list, so you can open it directly by double click on it. Like you want to read belladonna from this list, so just double click on your bella and your bella would open on your main display screen with a multimedia image of the plant, and you can read your remedy by scrolling like this. Now I'm going back to my analysis. So before I go back, I want to tell you this. Our software is known for all-in-one interface. Whatever icon you open will remains open in different tab. Like in this tab, we have analysis icon remains open. I'm coming back to my analysis. So this was all about the analyzing part of my case, how you can reporterize the case. Now I'm going back to my prescription part. So the medicine I have prescribed, phosphorus 200, 7 globules 8 hourly, followed by placebo 34 pills, TDS 3 times in a day for 15 days, was prescribed on first visit. Considering the repertorial totality, the patient improved symptomatically. The journal management I have given to my patient is along with the homeopathic medication. The patient was advised to select an appropriate maintenance skincare regimen for use at home. Ongoing protection is also required in order to prevent sun damage from recurring again in the future. Now moving further, in the next follow-up, patient have slight changes in discoloration of cheeks, irritability get better, and with continued treatment process, the facial pigmentation marks were improving day by day. Licoria slightly gets scanty, moderate improvement in itching and hypersensitivity to touch. So I have prescribed phosphorus 200 single dose stat orally followed by placebo 5 pills TDS 8 hourly for 15 days. Again, the general management I have given to my patient is lifestyle management can also contribute towards treatment of melasma. Wash your face no more than twice a daily using a gentle no soap facial cream cleanser and warm water. So in the third follow-up, journal amelioration in all symptoms with marked reduction in hyperpigmentation of face. Her skin was clean and clear. There was not any pigmentation marks left. She was happy with the treatment. Discharge from the vaginas better. Now she is more confident and positive towards life. So I've prescribed placebo 5 pills TDS for 15 days. So this was all about melasma. How can we reporterize the case with the help of synthesis Adonis and Radaropus software from my part? Alright, now I would like to request all our viewers to comment in the chat box with their questions now. So we will starting the question answer round. We will begin the question answer session. So the first question I'm going to take, so a learner wants to know, why do women get melasma when they are pregnant? So basically this I already discussed in the previous slides, but I told you this again. Pregnant women have increased level of the hormone estrogen and progesterone. These hormones are thought to contribute to your melasma. The darker color usually fades after pregnancy. Now I'm going to take the next question from a viewer side is melasma cancerous? Basically, melasma is not cancerous, a sign of cancer or a skin condition that turn into cancer. However, there are skin cancer that may mimic melasma, so seeing your dermatologist is often recommended to confirm the correct diagnosis. So basically, melasma is not cancerous. The another question from a viewer side is I'm going to take, is melasma painful? No, melasma is harmless. Basically, it's not painful, but it's itchy and uncomfortable in any way. So I'm going to take the next question from a viewer side is melasma permanent? Basically, melasma is a typically chronic disease or disorder. This means that it's long lasting, 3 months or more. Some people have melasma for years or their entire lives. Other people may have melasma for just a short time, such as during pregnancy. I think we have almost taken up all the questions. So let's take the last question from a viewer side is, can melasma appear overnight? No. Melasma appears slowly over a period of weeks or months. So let's wind up here. Thank you everyone. I would like to thank all the viewers and the homeopathic fraternity who have joined us here today. Thank you. Thank you so much. Have a great day. Keep learning, keep improving.